You are listening to Therapy Plus, a mental health podcast.
The views and opinions expressed by the guest speaker on this episode are solely those of the guest. The content shared is intended for informational purposes only and should not be construed as professional advice or endorsement.
Imagine waking up one morning, showering, putting on your clothes, getting in the car, and driving to work. But then, arriving there, you remember it's Sunday morning. You don't go into the office on Sunday morning. Or imagine this. You're swamped at work, your heart is pounding, thoughts are racing, muscles twitching. You grab your phone to check the time, but suddenly, your mind goes completely blank. You can't even remember your passcode, a sequence your fingers have repeated 1,000 times before. I'm Dr. Nicole Cain, and I'm the go-to expert for anxiety and panic. Today, you're going to learn my favorite technique for retraining your brain to be more present, in control, and panic-proof. Okay, let's talk about why the above scenarios might happen. Your brain is wired with programs that are largely on autopilot. A 2023 study published by Transportation Research on Traffic Psychology and Behavior reported that 90% of daily behaviors may occur with diminished conscious engagement in familiar settings. Your brain works hard, and it takes every chance it can get to rest. Autopilot is one of those resting states. Autopilot activation is seen when a group of regions in the brain that are referred to as the default mode network are activated. When we are in default mode, we tend to follow existing programs, repeat ingrained patterns, and we tend to be quite self-referential. Research has also found that anxiety and panic can emerge from overactivation of the default mode network. Remember, your brain isn't concerned about your well-being, it's concerned about your safety. So, when in doubt, anxiety, stress, or overwhelm, the default mode network will put you in autopilot to try to save you. Because these responses are more likely to help you fight the tiger, run away from the tiger, or freeze up in hopes that the tiger doesn't see you and make you its next meal. This is all well and good if you're wandering the jungle picking berries with tigers nearby. But a whole other issue if you're in a high-pressure situation, trying to navigate traffic, answer emails, or make a deadline. You need a brain and nervous system that is present, under your control, and resilient against stress and overwhelm. I'm going to teach you in 4 steps how to begin the process of reprogramming your brain and nervous system for calm on command. This is useful if you want to be proactive, present, and preventative. This process is also useful if you tend to feel panic, overwhelm, anxiety, and even dissociation. The good news is that these easy 4 steps can be useful for all ages and nearly all scenarios. The technique is called the Panic Reset, which you can learn more about in my book, Panic Proof. The Panic Reset is a 90-day program designed to teach you how to rewire your brain and body so you can experience panic-free, intentional living. The Panic Reset is a 4-step process. Step 1 is to calm the nervous system. Step 2 is to onboard your wise and analytical mind. Step 3, reintegrate mind and body. And step 4, restructure stress, panic, or dissociative producing patterns. The research suggests that it takes 90 to 120 days of reliable, repeated efforts for the brain and nervous system to create a new habit, so that autopilot is more what you want as opposed to what you've inherited. So while you should start to see results around the 30-day mark, I want to encourage you to give yourself more time. Try to target 90 days of consistent effort practicing the steps of the panic reset. And when you do, I am confident you will see results. So let's briefly go through each of these 4 steps. And if you want to expand on this, definitely check out the book, Panic Proof. Step 1 is to calm the nervous system. When the nervous system is activated, your brain may go into autopilot. The logical part of the brain shuts down and the emotional part of the brain takes over. We want to help shift your nervous system into a state of enough calm where you can get out of autopilot. When we get out of autopilot, our executive team, our analytical team, our troubleshooting team has space to get activated. This is called the executive control network. We have found in the research that when the default mode network is activated, the executive control network is deactivated. And when your executive control network is activated and you are in more control and you have access to your logical faculties, that we get out of autopilot and the default mode network is deactivated. Think of it like a teeter-totter. When one goes up, the other goes down. So the job of the first step in calming the next nervous system is to try to allow us to make that switch into executive control network. There are practical strategies to do this, and you are going to get the most benefit by tailoring it to your unique needs. And so today I'll leave you with a few examples of things you might try. The best results tend to come from those that stimulate your senses, the mind through touch, temperature, texture, taste, hearing, sound, scene. I like to teach people about making a panic pack, where it's a small bag that you can bring with you. Inside of that bag, it will contain things that stimulate your senses. It may contain an essential oil to smell. It may contain fidgets that have different textures and movements for your finger to experience touch. Or it may contain temperature packs, like a heating pack or a cooling pack. Temperature, especially cool around the eyes, can activate your parasympathetic nervous system to calm the body. A practical exercise that you might use to calm the nervous system in step 1 is to find 3 things you can touch, 3 things you can hear, and 3 things you can see. We call this the 3-3-3 rule. And so have fun making your panic pack. It can be whatever you want it to be, and it's something that you can bring with you. I also love using this for kids. Let's say that you don't have a panic pack. Let's say that you don't want to make a panic pack, or that panic strikes at the most inconvenient times, like you're checking an email or driving down the interstate and you feel like you're not in control of your brain and your nervous system. There are strategies that you can use without having to bring anything with you or depend on anything. One of the go-tos is the breath. When we exhale, it activates the parasympathetic nervous system. And so 4-count breathing can be incredibly useful, but as you do research, you might find that other breathing techniques work better for you. But the key with the breath is to make it slow, intentional, and you want to really emphasize the exhale. A 4-4-4 is a square breath where you exhale for 4 counts, hold at the bottom for 4 counts, inhale for 4 counts, and then hold at the top for 4 counts. Some people really say to exhale longer than the other steps, but when in doubt, it's easy to remember 4-4-4, do that. That's one of my favorite tips, and I use it with a lot of high performers, is really just work on the exhale Allow your breath to completely empty out of your body, and then a little bit more. Hold at the bottom, and then work on slowly drawing your square with the breath. And so breathing is something that you always have with you. Now let's go to step 2. We want to start the process now that the body is calm, now that we've followed step 1, now that the body will allow us to shift that teeter-totter, we're going to start to onboard wise and analytical mind. Interestingly, we have found in the research that if we can decrease connectivity to default mode network and increase connectivity to the wise and logical mind, that the shift is easier for people. And so this step is all about creating connectivity to your wise, logical, executive control network, mindful, problem-solving, troubleshooting mind. So we've calmed the body, which must be done first. Otherwise, step 2 won't work. So now that we're making that shift in step 2, you're going to start to make those connections. And here are a few practical strategies for doing that. One is focused attention meditation. This will help you to focus on one single thought, mantra, or object to help you stay in the present moment. It shifts you out of autopilot, activates your thoughtful and logical brain networks, the executive control network, and you can do this in 5 minutes every day. The focused attention meditation is done by sitting upright in a comfortable position. Allow your body to relax, keep your spine tall, and then you're going to choose an object for your attention, whether a fixed spot, maybe something outside, something in the room that you're looking at. Just pick that thing to focus on. Or if you do prefer to close your eyes, you can do that too. And if you close your eyes, you're going to imagine something to fix your image or your attention on. Maybe it's a word or sound or a phrase. If you study transcendental meditation, perhaps you've been given a mantra. And as you do this exercise, this focused attention meditation, you're going to inhale the word or the image or the thing that you're looking at, and then you're going to slowly exhale the image, the word, the thing that you're looking at. I like to do intentional words and phrases like, I'm okay. I'm on the inhale and okay on the exhale. Or I'm safe. I'm on the inhale, safe on the exhale. The second exercise that you might consider is to do things that challenge your brain. I love to do Sudoku on airplanes. It helps me keep my executive control network online so that if there's some bumps that my logical self can soothe my nervous system self, and it can make a very big difference in overall cognitive abilities. Now that we've gone through steps 1 and step 2, we've calmed the body, we've woken up your executive control network by practicing this focused attention breathing, by doing challenging puzzles. Now we're going to bridge the gap between mind and body. Have you ever had it where you feel like your mind is doing one thing and the body is doing something completely different? Maybe your body is panicky and your brain is telling you that you're fine. We want to solve this problem by bridging the gap. And that's what step 3 is all about, is reintegrating mind and body. Signs that your mind and body are not in sync is if you feel like you can't think. Like in that story, you open your phone, you want to put in your passcode, and you can't remember what it is. That's a sign that your analytical brain and your body aren't in sync. So what we want to do is we want to have cognitive awareness, intentional, awakened executive control awareness of the body's communications. And the way that we're going to do this in step 3 is to have that awareness without the impulse or the pressure or the need to change anything. And so what you might consider doing 5 minutes every day is do a body scan. You might start with your feet, noticing any sensations or thoughts or images, anything that comes to mind in your awareness when you notice your feet. And then you work your way up your body. You notice your knees, your hips. Perhaps you notice your tummy. You might be aware of a sensation in your back or an urge to move your back or to touch it or rub it. And I would encourage you in this step is to not do those things. We're simply practicing noticing. We're allowing, we're receiving the information without having to do anything about it. This is especially important if you have a history of adversity or trauma and your sensory processing has been changed in ways that make it difficult for you to feel comfortable in your own body. That is a normal response to trauma. And some people may feel dissociated from their body, or other people may feel extra sensitive to every little sensation. And so we want to just practice bridging the gap, just simply noticing, being present. Now we're going to move on to step 4. And step 4 is reprogram the body, how to get aroused and activated, and then how to calm itself again. So that when stress strikes, you've experienced this exact thing before and you've been in control and empowered before. You've done it 1,000 times and you know what to do. Personal power is the antidote to anxiety and panic. Again, personal power is the antidote to anxiety and panic. So what you're going to do in step 4, after you've done steps 1, steps 2, and steps 3, is you're going to practice activating the nervous system in the body and then bringing yourself out of activation. And you can do this every single day, and it doesn't have to be big and long and arduous, just small things. For example, you could do high intensity interval training. And this may be 5 minutes where you do a bunch of jumping jacks or burpees, or you run in place for perhaps 15 to 30 seconds. And then after that, you calm your heart, you use the breath, you slow down, perhaps you walk, or maybe you even rotate your torso, kind of gentle stretching, you sway, and then you do it again. You activate, you stimulate, you get your heart rate up, and then you slow the body down. So you put yourself into arousal, into activation, and then you calm. Other people, especially people who tend to be more pitta, who tend to be more warm-blooded, really report great results doing this with cold plunges, where you get in the cold plunge, you get activated because it's quite uncomfortable, and then you calm the body while you're in the cold plunge. I always recommend talking with your doctor before plunging, because for some people this could be very helpful and for other people this could be problematic. And so just get a medical clearance before you do that. And the great thing about cold plunges is that you get to remove yourself when you choose. You get to take back your personal power. So you're experiencing a lot of discomfort, and then you control how you exist in that discomfort and when you remove yourself. And that is incredibly powerful. Another idea is to do something that feels a little scary but is truly safe, like a high ropes course or maybe rock wall climbing. Is you're going to go to a height, you're strapped in, it's truly safe, but it can feel activating. It can feel stressful and scary. So you choose, I'm going to go to this height at my ability, and then this is how I rescue myself. So you practice going into activation and coming out of activation. So today we've talked about how sometimes the brain can get activated and how many of us have been programmed for safety, how 90% of our behaviors may occur with diminished consciousness. And so things that may be truly benign, like driving down the highway, taking an airplane flight, getting emails, feeling stressed by your kids, all of these things that are really not dangerous can start to feel big and overwhelming. And today we talked about a 4-step, easy, practical process that you can take to begin changing your automatic states so that you can be more present, in control, and panic proof. I'm Dr. Nicole Cain, and I am the go-to expert in anxiety and panic. I'm the author of the book Panic Proof, the new holistic solution to end your anxiety forever. You can find that at the library or anywhere books are sold. I also have a free 9 types of anxiety quiz that you can take on my website, drnicolecain.com, because not all stress and anxiety is created equal. And knowing the type of anxiety and stress that you're experiencing can help you identify treatments that may work better for you and to help you find root causes to help you actually get to the bottom of where your stress is starting so that you can actually heal. All of that and more can be found at drnicolecain.com. Also, be sure to check out my Instagram, Dr. Nicole Cain, and I have my own podcast. It's called the Holistic Inner Balance Podcast. Thanks so much for listening.